Welcome to the Living Guideline for Pediatric Concussion Care. Access the Living Guideline by visiting PedsConcussion.com or following the Living Guideline team on Twitter @PedsConcussion. Listen to an impact story from one of our concussion experts. Meet Dr. Carla Edwards, a psychiatrist who focuses on the treatment of mental illness and psychological struggles in athletes.
I'm Dr. Carla Edwards. I'm a psychiatrist whose practice works with athletes on a daily basis. I treat everybody from kids to adults and older athletes in supporting their mental health care across the board, including concussion care.
How can the Living Guideline for Pediatric Concussion Care help healthcare providers with their concussion practices?
The Living Guideline for Pediatric Concussion Care really provides practitioners with the one-stop shop to ensure that they are able to develop optimum best practice in concussion management. It addresses management and approach to patients from the acute phases of concussion and beyond. It was developed with multidisciplinary input into its development and maintenance and is adapted on a regular basis to newest evidence. The guidelines themselves contain algorithms, procedures, and forms to help guide the clinician in post-concussion management so that they do not feel that they need to create the wheel and build from the ground up.
If you were to give healthcare providers one tip about using the Living Guideline for Pediatric Concussion Care, what would it be?
If I were to provide healthcare providers with advice about how to best utilize the Living Guidelines, I would advise them to just access it as frequently as they need to. Bookmark the webpage. It is loaded with information. You can search for different aspects of concussion care and just keep it at your fingertips. It is always changing and it's got some great information, and utilize the expertise as it's there.
Thank you for watching and listening to this impact story. Remember, you can access the Living Guideline by visiting PedsConcussion.com or following the Living Guideline team on Twitter @PedsConcussion. Here is some information about Carla Edwards. Dr. Edwards is a psychiatrist and an assistant clinical professor of psychiatry in the Department of Psychiatry and Neurosciences at McMaster University. She has treated Olympians and athletes from organizations such as Swimming Canada, Athletics Canada, and TriCan, and is the high-performance mental health consultant for Swimming Canada. She is also a member of the expert panel for the Living Guideline for Pediatric Concussion Care. This video touched on the topic of best practices in concussion care. The views expressed in this video represent those of the interviewee. Those interviewed have provided their consent to be filmed for educational purposes and have approved the content within this video. This work was funded by the Ontario Ministry of Health, grant number 720. The template and icons used in this video were provided by Canva at canva.com. The image of Dr. Carla Edwards was taken by Trina Coaster Photography at trinacoaster.com. The media content in this video is for non-commercial use and is licensed by iMovie Apple software. The royalty-free audio soundtrack in this video is entitled Betty by Morgan Kibbe. Thanks so much for watching and listening to our video. Please access the Living Guideline by visiting PedsConcussion.com or by following the Living Guideline team on Twitter @PedsConcussion.